Hello, I'm Jenna, the RDH here at Riverside Center for Aesthetic Dentistry. We get a lot of questions about healthy gums, so today I'm going to answer the most common questions on that topic to give you a better understanding of oral health and caring for your gums. Healthy gums are important because they're basically the backbone to the oral mucosa. So they are the underlying component to the teeth themselves. We want to keep them free of bacteria just because they can get inflamed, have bleeding, and the structure that holds our teeth in place. So being able to tell if your gums are healthy or unhealthy is a big one. Again, we can see a lot of inflammation, redness, bleeding when our gums are unhealthy. That's going to be due to the bacteria that is underneath the gums that is also causing basically chaos underneath them. When they are healthy, they don't necessarily bleed. And that's why we want to use floss to get under those gums, disrupt all that biofilm, which is plaque. So it's that yellow kind of layer that can sit on the teeth and the gums. Yes, unhealthy gums can be fixed. A lot of times we like to, again, check the gum health with, it's called periodontology. So we take a probing measurement to see how deep those pockets can be. If they're a certain amount, so basically a number that is a little bit higher than what we'd like, we will sometimes recommend a deep cleaning. And that is us going underneath the gum surface more than normal. And we remove all of that bacteria that's underneath there, restoring them back to health. We can also curettage the gums slightly, which is taking off just a small little layer of the gums to remove all that bacteria that is sitting on them. So the process of a deep cleaning is going to be where we possibly give local anesthetic to make the patient more comfortable. We are essentially removing the bacteria that is on the root surfaces of the tooth because we're going a little bit deeper, meaning that our pockets are a little bit deeper. Bacteria is sitting on there. So sometimes we will inadvertently or advertently curettage the gums as well. So a lot of times the gums are going to be inflamed, bleeding. There could be exudate, which is like a pus type of liquid that can come out of the gums if they're inflamed. So we are removing all that tartar plaque buildup that has been calcified from the plaque. When doing a deep cleaning, we typically, depending on how involved the tartar buildup can be in the case, we like to do a half mouth per appointment, more so for the patient to be comfortable. So we don't want to be doing a full mouth, plus a lot of times we need a little bit more time in those areas. So we will do 2 quadrants, like I said, per appointment. So half a mouth and then half a mouth on the next visit. Also too, with anesthetic, we don't like numbing the entire mouth in one sitting. We can give you a different type of anesthetic, which isn't necessarily an injection style, which could be just topical on the gums. But a lot of times most patients do need local anesthetic for the comfortability because we are going a little bit underneath that gum to remove the tartar buildup. Yeah, so with deep cleanings, we like to see our patients typically every 3 months. We actually like to see them 4 to 6 weeks after the deep cleaning to then check the probing depths to see if the tissue has healed and to see if there's any bleeding. Then we want to keep them on a 3-month recall right off the bat because we want to maintenance that and make sure that it doesn't get to that point again with the tartar buildup. Once we start seeing you after a few months, the 3, we can then sometimes jump it to 4 if home care is kept up with well and we don't see as much bleeding, if we see tissues healing properly. And then a lot of times there's even a chance where we can put you back on a 6-month if we keep up with that. We just like the 3-month right away to make sure that we don't get that tartar buildup. Is deep cleaning painful? It can be. There are times where it is. If anything, I would just say more discomfort than anything. A lot of times, again, we will locally numb so that you are comfortable because we don't want you to feel that. A lot of times when we're on the root surface, that's when you can feel the sensitivity a little bit more. But with local anesthetic, it helps a lot of that so you don't feel too much of it. Best way to take care of your gums. We're typically recommending that we do a warm saltwater rinse if we feel any pain afterwards. Don't necessarily have to gargle it, but if you just want to let it sit in the mouth, it kind of helps with the pain afterwards. We do want to make sure too that we are running floss underneath those gums. I would say the first few days would be a little gentle with it because the gums may be a little tender from us going underneath them and removing all of that. But still making sure that we're flossing, disrupting all that plaque that's underneath the gums to prevent the buildup of new calculus. So a prophy is going to be a cleaning where we typically will see the patient. We're on a recall of every 6 months, meaning they have good OHI, which is oral home care instruction. So they're flossing, they're brushing, they're keeping up with that tartar buildup, keeping it to a minimum. So there's not too much buildup. When we're doing an SRP, which is a deep cleaning, it's more so that there is calculus or tartar buildup on the root surfaces. So we're technically scaling the roots of our teeth, which again is going underneath that gum a little bit more, trying to prevent bone loss from happening. So a lot more buildup and a lot more involved with an SRP. We're going to schedule that here, so we can do that at the front office, or you can contact anyone at Riverside Center for Aesthetic Dentistry.